Hey guys, so today I'm going to be going through the gastrointestinal drugs, and it's a little more in depth than probably what you need to know, but it kind of isn't. It's just a lot of drug classifications and sub-classifications. So um, let's get started and I'll kind of explain things to you a little bit. I'm going to present my screen. Hopefully you guys can see it. Okay, so gastrointestinal drugs. These are obviously, from the name, going to affect the gastrointestinal tract, anything from your esophagus all the way down to your stomach, intestines. All of that is going to be affected. Okay, so the first thing we're going to talk about is acid-related diseases and acid-controlling agents. So acid reflux or hyperacidity or GERD, which is gastroesophageal reflux disease, they're all kind of the same thing. It just varies based on how bad it is. So, for instance, for me right now, I have really bad acid reflux because I'm pregnant. Normally, I don't have it, but when I'm pregnant, about 5 or 6 months in, once the baby starts growing up into my stomach, it presses on the stomach and then presses the stomach into my esophagus. And it's extremely painful as far as the acid because it'll push acid into my esophagus even when I don't have food there, even when I haven't drank anything. If I drink water, it'll still do it. So I have to take medication pretty much every day for it to keep it from getting out of hand. Some people have this, and it's because of other issues that they have. Anything from just the way that their and esophagus work together. Sometimes people have something that the little flap between the stomach and esophagus opens up sometimes. And it's like hereditary or happens for some reason or another and they can get it. Some people, it's because they're overweight. There has been evidence to show that overweight people tend to have more issues with acid reflux. But some people that are overweight don't at all. So it just really depends on the person and how their body reacts to certain things. Other medications can cause it. There's just like a lot of different things that can cause acid reflux related issues. But basically, it's caused by an imbalance of the three cells of the gastric gland and their secretions. It can be an overproduction of stomach acid. It can be an underproduction, then an overproduction, like it overreacts and causes you to make more. Or it can be caused by, like I said, it's not necessarily a imbalance, but it could be that you have a baby in your stomach or something is not working right with the closure to the valve between the stomach and the esophagus that's supposed to stay closed. So lots of different things there. So the types of acid controlling agents that we use for this, so this is just an example of like a picture of what happens. Normally you have a flap over here that like closes that there. So you've got antacids. You have H2 antagonists. It's a type of antihistamine. And then you have proton pump inhibitors. Proton pump inhibitors, or PPIs, are the most, probably the most common for GERD patients or people who have like constant acid reflux. And it basically shuts down the production of stomach acid. It's got pros and cons. I pretty much have to be on it, but it's bad because it actually can lower your what's it called, immune system, because a big part of your immune system is your stomach, and your stomach acid kills a lot of bacteria. So if you don't have any stomach acid, it can actually be really bad for your immune system. So I kind of go back and forth. I try to take other stuff, but some days I'll take that but I'll try to wait a couple days to take it again. It kind of worries me that like I'm gonna get COVID or something because I don't have the stomach acid. Anyway, so we'll talk more about PPIs here in a second, but So antacids promote gastric mucosal defense mechanisms. They work pretty fast, but they're not super effective long term. Produces secretions of mucus, protective barrier against hydrochloric acid, which is your stomach acid. Bicarbonate helps buffer acid, so it like makes it less acidic. And then prostaglandins prevent activation of proton pump, which results in lower HCl production. Those are just different ways that it can work. Antacids do not prevent the overproduction of acid. Antacids do neutralize the acid once it's in the stomach. So, antacids reduction of pain associated with acid-related disorders. It raises the gastric pH because remember, the higher gastric pH is, the less or the more neutral, like less acidic it is, and then the lower numbers are more acidic, right? So it reduces the acidity, therefore reduces pain. And calcium carbonate is probably the most common antacid. Sometimes there's a like with Rolaids, I think it's calcium carbonate and magnesium, like they're together, but Tums just has calcium carbonate in it. It can cause constipation, also can cause kidney stones if you take too much. And a long duration of action may cause increased gastric secretion or rebounding, which makes it like to where you get even worse later. So that's not good. But I will say calcium carbonate is like the most common for just like occasional acid reflux. And then you've got H2 agonists. These reduce acid secretion. They are available over the counter. And what they do is they block histamine at the receptors of the acid-producing parietal cells. Most common can be Tagamet, Pepsid, Zantac, and Bonine or Antivert. They actually work Bonine and Antivert are Rx only, so they're prescription only. And they can actually help with, I think, with nausea and vomiting too, I want to say. So they're an antihistamine, but I don't think that they particularly work on just acid reflux. So, but they might work on both. And then, so I think Zantac was actually recalled recently. It may have been Zantac for pregnant women. So that's terrible. So I'm like careful taking this particular type of drug, although I've been taking Pepsid sometimes, but I'm kind of worried about them coming back and because they did recall Zantac for the pregnant women, that they're going to like do it for all of these different types. So I don't know. And then proton pump inhibitors, these are like, they're the most, they're probably the safest. They have less drug reactions, but at the same time, like I said, these are proton pump inhibitors. They kill the process of making acid, which is really what you need to digest food and for your immune system. So it can be bad over time. And in fact, some people have gotten infections in their stomach. It's called SIBO. I can't remember what it is, like what SIBO stands for, but it's a type of bacteria that starts to grow. Sorry guys, yawning again. It's a type of bacteria that grows in your stomach when you don't have any acid in the stomach for a long period of time. And then you have to like take antibiotics to get rid of that. And then you got to start tapering off these drugs so that you can, so that you don't get it. It doesn't come back. So that's a thing. So remember Prazole. So these are really easy to remember if you remember the suffix Prazole. So it's the ending of the words, and that so Prilosec, Nexium, Prevacid, all of them have generic names that end in Prazole. So Omeprazole, Esomeprazole, Lansoprazole, all of those you can remember they're proton pump inhibitors, and you can kind of remember them better because of the ending of the name. So That's how you can remember them. And remember that they're proton pump inhibitors, that they help with GERD. Yeah. And then this is just how proton pump inhibiting works. Total inhibition of gastric acid secretion, so that stops all the gastric secretion. And then, as you can see, all these end in prazole. So you need to remember prazole. So why should someone take them? GERD therapy, erosive esophagitis, short-term treatment of acid ulcers, and gastric bleeding. So like if people have major GERD or erosive esophagitis, which is basically like your esophagus is eroding, which can actually cause cancer long-term. That's one thing that they have found is people who have constant GERD for so long, for like years, and they don't treat it, it can break down your esophagus to the point where you start getting abnormal cells growing, and then it turns into cancer, like esophageal cancer. So you want to be really careful with that, and obviously want to heal your esophagus and get your GERD under control. And the same with gastric ulcers and bleeding, like that's a really serious thing. And if you've taken a ton of NSAIDs, remember we talked about how NSAIDs, non-steroidal anti-inflammatory drugs, can actually cause, if you take them too long, too often, they can cause gastric bleeding and ulcers. If that happens, then you have to start taking PPIs to basically stop the acid production so that this can heal. So, you know, at the end of the day, like if you think about it, like there can be some serious side effects from taking over-the-counter drugs, you know, for too long and taking too much. And so that's why it's important that we all get informed and we inform our patients too. And you as a, you know, pharmacy tech are not going to obviously be counseling patients, but if you see something where people are taking like long-term Advil or something like that, like you could tell the pharmacist and they can talk to the patient. All right, and then diarrhea, abnormal frequent passage of loose stool or abnormal passage of stools with increased frequency, fluidity, weight, and with increased stool water excretion. Some things that can basically slow the walls of the digestive tract or coat the walls are Pepto-Bismol and Imodium. Activated charcoal can also work, although some of these are not on the top 200 drugs list. I know loperamide is. I've seen that on practice tests on NHA. So you really want to know Imodium or loperamide. And I'm pretty sure Pepto-Bismol is on that 200 list also. Important, do not give. Oh, this is one important thing, you guys, to note. So I can never say this word, but so Pepto-Bismol, it's a type of, it's called subsalicylate, similar to an aspirin product. And children under the age of 12 should never have aspirin products. So children under the age of 12 should not have Pepto-Bismol, and they should not have aspirin. They're contraindicated for children under the age of 12, especially with flu-like symptoms or chickenpox symptoms, because they can get Reyes syndrome. So just remember that. They usually will ask a question about that, like what's contraindicated for children under 12, and this would be Pepto-Bismol or bismuth subsalicylate, salicylate, and aspirin. Both of those things would be contraindicated. So don't forget that. Antiflatulence basically relieve painful symptoms of gas. It can break down gas bubbles in the stomach. Beano can help with digestion. I think Beano actually isn't on the top 200 list anymore. It might be. I can't remember. But I'm pretty sure simethicone is, or Gas-X. Constipation, abnormally infrequent or difficult passage of feces. It's a symptom, not a disease, so it can be caused by lots of things. And let's see, laxatives will help you poop. So you've got bulk forming. These are usually high fiber, things like Metamucil or Citrasil. I'm pretty sure Citrasil is on the list. Metamucil might also be on the list. Then you've got emollients, which are a type of another type of laxative. It's another subclass of a laxative. And these basically put more water and fat into the stools. For example, Colace is more of a it'll soften the stool through kind of like an oil base. And then Miralax, they actually added that to the top 200 list this year. And it's a water bulking laxative. It just makes more water go into your feces, I guess, to help it to pass through. Then you got saline laxatives. These are things like magnesium, Epsom salts, sodium phosphate, like a fleet enema. This is actually usually going to go up the anus. Like if you've ever heard of a laxative, or an enema, that is usually when you get to the point where you like cannot poop and you have to do something to get it out. And this breaks up the poop basically and gets it out. So pretty messy sounding. I've never had to do that, but I've known people that have, and it's a messy process. So yikes. Definitely don't want to do that. Funny story. When I had my baby, my first baby, I like after birth, you're like really, really constipated. It's like the weirdest thing. I guess because of all the medications they give you. I don't know. But they like had to give me all of these medications to like make me go, because otherwise they were like saying I would have to have one of these. And I was like, oh, I do not want that. So anyway, the medication they gave me worked, but it was disgusting. They gave me a magnesium prune drink. It was really gross, but it worked. Laxatives, the stimulant laxative increases peristalsis via intestinal nerve stimulation. This can be castor oil or senna. And these are a little more, not, I wouldn't say dangerous, but they could just give you really bad, like painful diarrhea or poop if you take too much of them. And it can cause like stomach cramping and stuff like that. So stimulant laxatives are usually like the last route you want to go. All right, and then antiemetic agents. These are some key terms you want to know. So nausea is that unpleasant feeling that precedes vomiting. Emesis is actually vomiting. So if you hear like anti-emesis or antiemetic, it means anti-vomiting. But it usually works on nausea and vomiting because they go hand in hand usually. Forcible emptying of gastric and occasionally intestinal contents would be emesis. And then antiemetic, like I said, antiemetic agents are used to relieve nausea and vomiting. So there's just some different mechanisms of action when it comes to nausea and vomiting drugs. So you've got antihistamine, antiemetics, kind of like I talked about earlier. I put these in there, but like Bonine was in there as a antihistamine, and then Dramamine is also an antihistamine, and these help really good with or really well with nausea and vomiting. Dramamine you can get over the counter. Bonine, I'm pretty sure, is only an RX only drug. Other antiemetics, Zofran or ondansetron and Finnegan, these are prescription only and are given as antiemetics. And then Emitrol is OTC and calms the stomach muscles, but not as effective as others. It's kind of a strange drug. I actually took this for the first time about a month ago when I had the stomach flu. I was so sick, and I called my doctor and was like, what can I take? Because I'm pregnant. And they said, get Emitrol from the store. It's like a liquid, like a really sugary liquid, and it's supposed to help. And I was like, I don't know if this is going to help. But I decided to get it, and it actually worked, you guys. Like, I stopped throwing up when I took it. So it's really, it can be effective. I don't know. I thought it was effective. I'd never taken anything like that before, but Yeah, and it's safe. It's over the counter. It's more of a it's like a dextrose, which is like a sugar type of drug. I don't know how it works though. Like I mean, when I was reading the ingredients, I was like, "Huh, this doesn't make sense of why this would work." But I don't know. So I calmed my stomach muscles down enough to where I was okay. Um, all right, and then last but not least, this is not on the top 10, 200 drugs, although at some point when it's probably legal everywhere it will be, but is tetrahydrocannabinoids, or THC. It's a major psychoactive substance in marijuana, inhibitory effects on reticular formation, thalamus, and cerebral cortex. It alters your mood and brain perceptions of surroundings. It can help tremendously with nausea and given frequently to cancer and hospice patients to ease symptoms. So, a lot of states um, have THC as a even if they don't have um, cannabis legalized there, they may have it for medical purposes. So, um, it depends, on the place. So that is that. Thought that was interesting, so I added that in. All right. We are done with this gastrointestinal drugs. Thank you for sticking around with me. I know it was a little bit longer. Um, and Miss Walsh will be going over the list with you guys to check to make sure you guys had got all the words correct. All right. Bye, guys. Have a good day.